Good afternoon. Thank you for joining us. Well, today, Vernon's last walk-in clinic will close permanently. Now, the owners say they don't have enough support staff to keep it open. We'll hear more about the situation and ask, what's your experience with walk-in clinics in your community? And the Victoria MP has presented a private member's bill to outlaw what's known as coercive control in intimate partner relationships. Laurel Collins will join us after 12:30. Later in the show, is New Westminster the place to be? The Price is Right thought so and included a stay in New West in a prize pack. Is New West underrated? I'm Michelle Eliot. Welcome to BC Today. Thank you for joining us on CBC Radio 1, live streaming on CBC Gem, cbc.ca/BC, and on the CBC Vancouver YouTube page. Well, despite pleas from physicians and funding from the province, Vernon's only remaining walk-in clinic is closing its doors today. The owner of the Sterling Centre walk-in clinic says they have more and more patients without family doctors, many with complicated medical conditions. A notice on the clinic's doors says it will be closing permanently November 15th. CBC reporter Brady Strachan has been covering this story, and he joins me now from our studio in Kelowna. Hi, Brady.
Hi, Michelle.
Well, you've been covering this on an ongoing basis. What is the history behind this closure? How did we get here?
Well, Michelle, like many communities, Vernon once had many walk-in clinics where people could go for, if you've got an earache or you just need a prescription update. But over the years, they have disappeared. And just, there used to be 4 walk-in clinics in not too long ago, but they have slowly closed. And now in October, the Sterling Centre walk-in clinic gave notice to its patients that it was also closing. And this is the last one in Vernon. So a real kind of sense of a crisis here, because as we know, many patients don't have family doctors, and they tend to go to walk-in clinics to get that type of care. So this has been something that has been known for over a month. There has been a lot of back and forth and work behind the scenes, but today is still the last day of the clinic. So it is what many people are calling a bit of a healthcare crisis in Vernon.
What has the clinic said is the biggest issue?
We spoke to one of the directors, Dr. Chris Cunningham. He has his own family practice, but he's one of the directors of the walk-in clinic. And he says what has happened is that they have many people who come through the doors are unattached patients. They don't have a family doctor, and some of them have quite complex healthcare needs. And he says what the clinic has been asking for is supports for that patient group. Everything from more nurses to mental health workers to people to help with triage, even security. So that's what they have been asking the province and Interior Health for. And according to them, they haven't been getting those kind of supports as to what they would need. And so they just say they can't continue like this, treating all of these complex care patients in a walk-in clinic setting. And they're set to close their doors at the end of today.
Now, we did request an interview with Health Minister Adrian Dix. Just heard word that he's not available. Interior Health also not available today. We do have a statement from them which says it recognizes the impact of the closure of the Sterling Centre walk-in clinic for Vernon and area residents. Many residents will have questions about what this closure means to accessing care in Vernon. I'll read more of the statement, but what are you hearing in terms of the impact on people in Vernon of the closure of this last walk-in clinic?
Yeah, I went to Vernon yesterday just to speak to people outside of the clinic about what this means to them. And as you can imagine, almost everyone I talked to expressed their concern about the imminent closure. Let's have a listen.
Oh my goodness, we're struggling so much already for doctors. I've been looking for a doctor since 2014. So really we need this more than anything, and we need more doctors, more nurses to support us, because we need that support. in our system anymore, and it just seems like our government has failed us into supporting us, in ways that they used to do it no problem. Now they just seem like they're giving up on us and saying, go ahead, just die. It's just sad, how they would ignore us all as individuals that we need help in one way or another, and whether a different kind of sickness or diseases or feelings and thoughts and feelings. So we got to see a doctor first to get an order, just to get a prescription or to see someone specialist, right? Like for your shoulders, or say you got into an accident and you got to say, well, go to a walk-in doctor, or you got no doctor to see.
Well, it's dire, especially for people who don't have a doctor, and then it's gonna, well, what these guys seeing, 100, 200 people a day? Now they're all gonna go to emergency. That's gonna put a lot of weight on those guys. Actually, I was talking to one of the doctors in there, and he said that's what he's expecting. So it's not good.
What does that mean for healthcare in Vernon?
It means the majority of people who don't have any income or very low income are going to be the ones that pay the price for this, And there's no doctors taking any patients anymore. So we're in dire straits here in Vernon for healthcare, really.
And Michelle, you get the sense that it's a real bitter pill to swallow for patients in Vernon as they watch the healthcare service slowly erode there. And not only patients are speaking out about this, but physicians themselves have spoken out about it. Last week, emergency room physicians at Vernon Jubilee Hospital put out an open letter talking about the grave concerns they have when the clinic closes and what is going to happen to the 100 or 120 patients that go through there every day. Will they come to the emergency room for their primary care? They say the emergency department is already stressed and already quite busy, and they don't have the capacity to handle those primary care needs for people that might show up at their door.
And Brady, you mentioned there was a lot of work over the last month to try and keep this open. What were the efforts that were made?
Yeah, I reached out to Interior Health and also the Ministry of Health, and I wanted to have interviews with them. Both of those agencies declined. They did send statements. The Ministry of Health statement is attributed to Health Minister Adrian Dix, and it says that the province has tried to keep the clinic open. It says it offered a little more than $75,000 this year to keep the clinic open this year, which it accepted. It offered another $75,000 to keep the clinic open until next spring, as well as close to $300,000 in physician compensation to help keep the clinic open. But Dick says the clinic has not chosen to take up those offers. And at the end of the day, this is a private health clinic. The province and Interior Health can't force it to stay open. And Dick says the decision in the end lies with the directors to open or close it. Interior Health has also said that and spoke about those discussions and says that it appreciates the work that the clinic has done, but as it's a private clinic, it can't force it to stay open either.
And you mentioned the concerns by physicians at Vernon Jubilee Hospital about what kind of pressure this will put on them. What does happen now? Where will people have to go for care?
It's a good question, and Interior Health says that there is an urgent primary care center that people can go to for their basic health needs. It also says that people can dial 811 to access HealthLink BC, and a medical professional will help to direct where their health needs are. And it says that, people can go to drugstores and also get emergency prescriptions there from pharmacists. That's something that's now also available. But you really get the sense that these 100 or 120 patients are now, if they do go to the urgent primary care center or even emergency, it's just going to clog up a health system that's already quite stressed in the North Okanagan, because it's not only people from Vernon that would go there. Communities like Lumbee, like Armstrong, and other rural communities outside of Vernon, people would go there to this walk-in clinic. So it's a real challenge, Michelle.
Brady, thank you so much for your reporting on this. Really good to have you.
Thanks for the opportunity.
CBC's Brady Strachan joining us from Kelowna. And we also requested interviews with Health Minister Adrian Dix, as well as a representative from Interior Health. Neither could join us. A statement sent to the CBC attributed to Minister Dix, as you heard from Brady, read in part that the clinic declined additional money to keep the clinic operating until March. And in the end, he says it is the decision of the clinic to close. And Interior Health also sent us a statement, and it reads in part, we recognize the impact of the closure of the Sterling walk-in clinic for Vernon and area residents. Many residents will have questions on what this closure means for accessing care in Vernon. And while long-term plans are underway, community members can continue to access primary care services through their family doctors, family nurse practitioners, or book same-day urgent care appointments at the Vernon Urgent and Primary Care Centre. People are also advised to call HealthLink BC at 811. Well, you can call in with your own experience. What is it like going to a walk-in clinic in your own community? You can call us 1-800-825-5950, 604-669-3733. You can hit pound 690 on your cell phone as well. Joining me for this discussion is Paul Adams, Executive Director of the BC Rural Health Network, and Adrian Gill is President of the BC Nurses Union. Welcome to you both.
Good afternoon, Michelle.
Well, first, I'll ask you, Adrian, what is your reaction to this clinic, the last walk-in clinic in Vernon, closing down today?
Yeah, it's certainly a concerning situation. We know that, walk-in clinics, urgent primary care clinics, emergency room departments are already stretched very thin. There's, significantly more patients that are requiring care, and yet the options are becoming increasingly limited. So certainly very concerned about this development.
And Paul, from a rural care perspective, how concerning is this?
I think it's indicative of the larger problem that we've been seeing, and an ongoing problem which, continues to hit rural as well as urban populations in declining service and equity and access to service for many residents.
And Paul, what is the biggest challenge when it comes to walk-in clinics? How do they fit into the larger issue of lack of primary care?
Again, we see walk-in clinics as having a key role in areas where there are existing primary care and physicians, family doctors, and care centers in community, where they fill a gap between, someone having an immediate need and going to the emergency department. In a similar way that the urgent primary care center has a similar model of walk-in service and care provision. What they lack is the attachment for the long term and the longitudinal care that patients need in order to have a healthy lifestyle for long term. So we see a need for better health models which are more community centric, and that they are specifically designed for a community with the help of a community, and having community engagement brought back into healthcare is a key piece and a missing piece. And community health centers is an example of one of those models of care which works quite well.
How many do we have in BC?
There's around 30 and some up and coming opening community health centers. And these models of care build a better team-based environment. And that's really what we're seeing, I think, in Vernon, is the lack of team-based environment and not being able to provide the supportive services that are mentioned for these complex care cases which walk in the door. So, we need safety for the front-end worker, for the nurses, for the primary care provider. And we need a better team-based atmosphere which has more holistic and wraparound services, including things like mental health support and long-term care.
Well, it seems like there's a lack of a team. They don't have enough nurses, nurse practitioners, and those mental health care workers, was what one of the doctors told CBC. What are the challenges of recruiting nurses to walk-in clinics, to rural parts of BC? Adrian?
Yeah, well, I can certainly share that it's a challenge retaining and recruiting nurses to all areas of healthcare within BC. Certainly, there's significant impact in more rural and remote areas, but the nursing shortage is felt everywhere. It's felt in acute care facilities, in home and community settings, also in long-term care. It's a significant problem. We have almost 6,000 nursing vacancies in this province, and we're certainly seeing the impacts in all care environments.
Okay. And when we hear about team-based care, how hopeful or optimistic are you that that is a model that we can continue to pursue given those retention challenges?
Well, I think we're certainly open to considering different models of care. Nurses, LPNs, registered nurses, certainly, and registered psychiatric nurses certainly can provide. There's an ability for us to work beyond our current scope with additional education and support to do so. And so nurses are certainly prepared to assist in this way, but we certainly need more nurses, and nurses need to be supported to work in those environments. But certainly we're keen. We're certainly very much in support of innovative care models, as long as patients are getting the care that they require. We're open to considering all sorts of different options.
Okay, that's my guests, Adrienne Gear, president of the BC Nurses Union, and Paul Adams is executive director of the BC Rural Health Network. Now, the last walk-in clinic in Vernon closes today. The owners of the clinic have said in the past to CBC in the last few weeks that this is because they can't find enough support staff to keep that clinic going. And as you heard earlier from some of the folks our reporter Brady Strachan spoke with, they are worried about what that will mean for the community, as many people don't have a family doctor to see. We're asking you, what's your experience with walk-in clinics in your community? Our number is 1-800-825-5950, 604-669-3733. On your cell phone, you can hit pound 690. Ruth is calling us from Williams Lake. And what's it like for you, Ruth, to gain access? Yeah.
I've lived in Williams Lake for just over a year now. I broke my arm this past May 25th and had to go to the hospital here to have it set in a cast. I had wonderful doctors here, Dr. Dressler. She's amazing in the ER here. But they do have a doctor shortage here. There are no walk-in clinics. It's very difficult to get a doctor up here with Interior Health. They do have a program that puts you on a wait list.
And are you on a wait list right now, Ruth?
I'm very privileged. I still have a doctor in Vancouver who sees me over the phone.
Oh, wow.
Thanks to COVID, she learned to do phone appointments. And I'm very privileged. I have a wonderful doctor in Vancouver who talks to me over the phone, as do both of my specialists. I see a neurologist and an endocrinologist. Both in Vancouver, and they talk to me on the phone. However, when I broke my arm this summer, I needed to get x-rays every 2 weeks to see if I needed to go for surgery or not for my arm, because I'm 52 years old, and I had a bike riding accident, and they wanted to make sure my arm was okay.
Sure.
There are no walk-in clinics that I know of in the Caribou. I went to 100 Mile from Williams Lake looking for one because there used to be some there. They're not taking any patients.
No.
So I couldn't get any.
Ruth, are you there? Ruth, can you hear me? Okay. Unfortunately, our connection with Ruth has been cut. My apologies for that. But Ruth's point was that there is to her knowledge, no walk-in clinic remaining in Williams Lake. And so for someone who needed to keep needed ongoing care, just a monitoring of a broken arm, she had to go to 100 Mile Health. She was looking for a walk-in clinic, but it sounds like they were not taking any new patients. So that must be very challenging. But as she mentioned, she does have the privilege of having a family physician and specialists in Vancouver. Thanks so much for sharing that, Ruth. Joanne is up next now in Kamloops. Hi, Joanne. Thanks for calling. And what do you want to say about walk-in clinics?
That they're all closing. But the reason I'm calling is because I do know in Vernon they have the pivot pharmacies. And I know that pharmacists have really stepped up to help with some of these things, and there's lots of prescriptions that they can handle.
Right.
So I wanted to offer that out there because it's just a fabulous opportunity. We just got a pivot pharmacy here in Kamloops, and boy, has it helped a lot of people.
Wow. Okay. And is that something you've availed of yourself?
Yes.
Okay.
Yeah, and it's really great because they're open and bright, and you can get all your shots, you can get all your pills. So you don't need to go to the doctor for that stuff anymore, for, like a bladder infection or something.
Yeah. Joanne, thank you very much for that point.
Okay, thank you.
It's a good one. That's Joanne calling us from Kamloops. Let's go back to our guests. Paul Adams, Executive Director of the BC Rural Health Network, and Adrian Gill is is president of the BC Nurses Union. I do want to ask about that. Maybe I'll go to you first, Adrian, because nurses very recently have also, as I understand it, been able to expand their ability to deal with mental health cases. Is that right?
Maybe you're referring to nurses with certified practice designation.
Yes.
Are to support patients with substance use disorder.
Yes.
And so that's a new certified practice designation that registered nurses have. So certainly in that situation, they're able to help patients with substance use disorders.
And I guess you're right. This is quite a recent announcement. And with our caller there, speaking from Kamloops, talking about pharmacists being able to prescribe more medications, is this about filling in the gap when people don't have access to family doctors? Is this about expanding roles, perhaps, for more of those, more staff, more healthcare workers to be able to fill those gaps, expanding the roles of people like nurses? Is that something that you see?
Well, certainly it's something that we're seeing, and I think that the pharmacist example is a good one, and I think this does help in some situations, but I think we also have to remember that we still need physicians, we still need nurse practitioners, we need our community patients, the citizens of BC need access to that primary and longitudinal care. That is so important because you're looking at, prevention, you're looking at chronic disease management. And so without, healthcare providers, it makes it very difficult. And certainly, yes, can pharmacists pick up some of the gaps? Absolutely. Can nurses work to a fuller scope? Absolutely. But each member of the team is really essential. And in terms of what this represents with this further closure of another walk-in clinic, yes, maybe a patient can go get a medication renewed at the pharmacy, but what about those patients that actually need to be assessed? And when we already have emergency departments that are overcrowded,
right?
There's already so much demand. What this is going to mean is, yes, some patients can go to the pharmacist, but many will still need to access the emergency department. And it's not necessarily for emergency care, but that requires care, and that assessment is still required. And so it really does put an additional strain on a system where we simply do not have enough doctors, and we do not have enough nurses and other healthcare providers.
Let's take one last call here. Judy on Vancouver Island. Hi, Judy. You're a retired nurse? Hi, Judy. Can you hear me? I think we don't have our connection with Judy as well. She is... Judy, can you hear me now? I think Judy is there, but I'm not sure she can hear me. Thanks very much for the call, Judy. I apologize we're not able to hear you. Let's go to Paul Adams on that last point about, and when it comes to pharmacists in BC will now have more responsibilities. And this was starting June 1st. Of this year. And this is again to improve access for those without a family doctor. And so this is pharmacists in the community who have completed certain training required will be able to diagnose and prescribe medications for 21 minor ailments, including acne, shingles, or urinary tract infections, as well as prescribe contraceptions. And so that was an announcement of the expansion of what pharmacists can do earlier this year. What do you see? You talked about community and team care, Paul. How can we make walk-in clinics more sustainable then, if they are filling these kinds of gaps?
I think we have to have new models of care which are more inclusive of all of these different skill sets. So pharmacists certainly are providing an enhanced service and providing more services to more people, and that's a great addition to the team. It's the team that we have to really build around, and we have to make sure that those teams are appropriate for the communities they're being placed in. And those need to be looked at on a community by community basis. So a walk-in clinic has a purpose in a larger center, but in a smaller rural community, if it's your only point of access, you're just not going to be attached to primary care provision for the long term. And we really need that longitudinal support, and that team environment creates a place that we can recruit to, that we can retain staff in. And provide better equity and access to people to receive care. So improving the team and increasing the services that are available within a healthcare center setting and providing longitudinal support are really key components that we're losing at a rather drastic rate.
Another picture into what's happening with the healthcare system here. Paul and Adrian, thank you so much for your time. I really appreciate it.
Thank you, Michelle.
Take care. Paul Adams is Executive Director of the BC Rural Health Network. Adrian Gear is President of the BC Nurses Union. It is 12:32, 1:32 now in the Mountain Time Zone. I'm Michelle Eliot. You're with BC Today here on CBC. We're on Radio 1, 88.1 FM in Metro Vancouver, and live streaming as well on CBC Gem, cbc.ca/BC, and on the CBC Vancouver YouTube page. Time now for a CBC News Update, and here's Susan McNamee.
Good afternoon. In the news, Vancouver police say 2 people were arrested outside a restaurant in Chinatown last night after about 250 protesters gathered to demand a ceasefire in the fighting in Gaza. Prime Minister Justin Trudeau was inside the restaurant at the time. The VPD says 100 officers were sent to help with crowd control so that the Prime Minister and his entourage could leave. At one point, police allege a 27-year-old Coquitlam man attacked a female officer. Another person was arrested for obstructing police. The province says that repairs to the Coquihalla Highway 5 are complete and bridges have been rebuilt to withstand future extreme weather events. Several parts of the highway washed out 2 years ago during that atmospheric river. The province said the final price tag on the project, including repairs to Highway 8 and Highway 1 through the Fraser Canyon, is estimated to be between $1 and $1.5 billion. BC says the federal government is expected to cover between 70 and 90% of the cost. And the province will test its emergency alert system this afternoon. People can expect to receive the alert at 1:55 p.m. or 2:55, depending on where you live in the province. The test message will be sent to cell phones and will be seen and heard on radio and TV. The test is meant to assess how prepared the system is for an emergency. But just to repeat, this is not an emergency. It is just a test. Turning to the BC weather on the south coast, a few showers ending this afternoon, then mainly cloudy, a high of 7. For the central interior, you've got a day with a mix of sun and cloud and a high of 0. For the southern interior, cloudy, a 40% chance of showers or flurries. Tomorrow, sunny skies, a high of 5. And up in the Peace, it's a sunny day today. Tomorrow will be cloudy and windy with possible flurries or showers with a high of 3. I'll be back at the top of the clock with all the latest BC news and weather, but right now it's back to BC Today and Michelle.
My ears are ready and prepped for that emergency test.
You always get that little start when you hear the buzz start to go off. So hopefully people are adequately warned and won't react negatively.
Yes, I've had members of my household run up. They were watching something on TV and then suddenly heard that noise. What's going on? Oh, yes, I forgot to mention and remind you that there's a test coming up.
Gets your attention, and that's what it's supposed to do.
I guess it does the job in that way, but be ready. It's not exactly, soothing music. Get those ears ready. Protect them.
Absolutely. We'll talk soon, Michelle.
Thanks, Susan. Susan McNamee in CBC Vancouver's newsroom. Thanks so much for that. It is 12:36, 1:36 in the Mountain Time Zone. Yes, be ready for that emergency test coming up shortly this afternoon. Well, 50 years ago, Rick Hansen began his rehabilitation journey. Now, it followed a devastating car crash that left him with a spinal cord injury. Now, Karis Hope from CBC reports on this and tells us he's now celebrating that journey of recovery back where it all began in Vancouver.
Years before his Man in Motion World Tour in 1985, Rick Hansen arrived here at GF Strong Rehabilitation Center following a devastating car crash. That was half a century ago.
It's hard to believe that 50 years ago, it was a 16-year-old patient just being admitted here, and I was scared out of my mind.
At the center on Tuesday, Hansen spoke of all the people who inspired him, including his physiotherapist, Avril Corbett, who encouraged him to believe in himself.
Avril, you are an amazing difference maker.
Thank you.
You had a profound impact on my life, and I am so grateful for all that you did to help me move forward.
My pleasure.
And through Hansen's life, the inspiration spread. Jocelyn Maffin with spinal cord injury BC has been using a wheelchair since she was 9 and says seeing Rick Hansen return from his Man in Motion World Tour was life-changing for her.
It was a motivating factor in my upbringing and independence, and realizing that people with disabilities like mine could truly do just about anything.
Dr. Brian Kwan, a spine surgeon at VGH, dedicated his PhD thesis to Rick Hansen. He says Hansen brings people together to advance spinal cord research.
I think that he's had an enormous, role in actually concentrating this interest and this expertise here in Vancouver.
Kwan says people in BC get some of the best spinal cord care in the world because of what the Rick Hansen Foundation has done. Hansen himself says this ceremony was about shining a light on the rehabilitation community, which often gets overlooked. But it doesn't end here.
And also to still continue to set the bar higher, to move forward, to make things better for British Columbians, and to be an example for the world.
Karis Hogg, CBC News, Vancouver.
This is BC Today here on CBC. I'm Michelle Eliot. Very nice to be with you this afternoon. Well, we are continuing our coverage of the issue of intimate partner violence. A Victoria NDP MP has presented a private member's bill to amend the criminal code to include controlling and coercive conduct. Now, a reminder, the story will deal with sensitive matters. If you think you're a victim of intimate partner violence, you can call or text Victim Link BC at 1-800-563-0808 or send an email to victimlinkbc@bc211.ca. Well, Bill C-332 was introduced last May and is currently in its second reading in Parliament. Here to tell us more is the sponsor of that bill, Victoria MP Laurel Collins. Good afternoon. Thanks for joining us.
Good afternoon. Thanks so much for having me on.
What prompted you to sponsor this private member's bill?
Well, years ago, I worked for Victoria Women in Need, so supporting women who were in transition houses after experiencing intimate partner violence as they moved out into independent living with education, support, just all the things you need when you're in that situation and moving forward. But for me personally, the first time I saw coercive control and recognized it was when my sister showed up at my doorstep in tears. Her partner had taken away her keys. He had taken her cell phone and her bank card. Luckily, she had another set of keys and was able to make it to my place. But this was the first of many incidents over the next few years that eventually, like so many other examples of coercive control, led eventually to physical violence. And I'm so grateful she is out of that relationship. She's free. She's doing great. But, so many people experience coercive control, and it's in 95% of intimate partner violent, like physical violence situations. So it's one of the key risk factors that we could have as an opportunity to intervene before violence happens. It's also one of the key risk factors when it comes to femicide, even in situations where there has been no physical violence.
Mm-hmm. How you've given some examples there, and I'm sorry for what your sister has gone through. How would authorities determine coercive control?
Yeah, so coercive control is a pattern of behavior. Unlike the way we criminalize physical violence, where it's specific individual instances, coercive control is a pattern, and so things like taking away someone's passport or immigration documents, breaking their cell phone, tracking them online, denying them access to social media or other ways of communicating. It's really cutting them off from their support network often. But also things like controlling what they eat, controlling what they wear. Oftentimes, coercive control starts slowly, and the people who are victims of it don't realize it's happening until they are fully, until their independence has been limited so much that it feels impossible to escape. So we want to make sure that they and their support networks and police have the tools they need to intervene and to help people get out.
And so what difference and what impact do you hope this bill will have?
Well, we know this bill is modeled off of a bill that passed in the UK in 2015. The UK passed a law, and since then they've seen an increase in people reaching out for support, an increase by 31%. And so just that shift in the criminal code, had people become more aware of coercive control, and people are reaching out to frontline organizations and to police to get help. But also, they've had convictions of people who are engaging in coercive control. We also know there are some horrific examples here in Canada. Every 6 days, a woman is killed from intimate partner violence. In 2020, the Nova Scotia shooter, the public inquiry found that he had a history of gender-based violence. And years before, he had taken the tires off of his partner's car and locked her out of the house in an attempt to prevent her from leaving. We want to make sure that we catch those signs early, that people know these are red flags, that this behavior is completely unacceptable, and that we give them the tools to address it.
Where is this bill now, and what kind of support have you seen then?
Yeah, so it's just come up for second reading, which is the debate has just started on the bill. I am really grateful that we have had cross-party support for the bill. 2 years ago, the Justice Committee studied coercive control, and they recommended that the government pass legislation. Unfortunately, the Liberals have delayed and honestly disappointed advocates and survivors who have been pushing for this. It's why I've put it forward, and I'm so happy to hear that the Liberals, the Conservatives, and the Bloc will all be supporting the bill.
And how do you envision ensuring that the rules would be put in place if this does pass, ensuring that it does make a difference? What will the monitoring process be like?
Yeah, I think there's a lot of things that need to happen along with this change to the criminal code. One of them is education for prosecutors, for judges, for all the people who are engaged with the criminal justice system, who support people and victims as they move through it. So we need to make sure that those people are fully educated on how it's implemented. And that's one of the lessons learned from the UK. Their conviction rate was quite low in the first few years, and people weren't actually using the tools in the criminal code. So we want to make sure that that happens. But we also need to push this government to support frontline organizations to invest in ensuring that victims of intimate partner violence, of coercive control, have access to support throughout the criminal justice system and have support more broadly as well.
Laurel Collins, thank you so much for joining us to tell us all about it.
Thanks so much for having me on.
Have a good afternoon.
Take care.
Laurel Collins is the Victoria NDP MP. 12:45 now, 1:45 in the Mountain Time Zone here on BC Today. Well, when was the last time you were in New Westminster to enjoy a day, a visit? One of the biggest stories on social media in BC this week has been around The Price is Right, giving contestants the chance as a prize to travel the world. But this time, the prize involved a visit to New Westminster and a 6-day stay. It was the 5th time the show had featured a city in BC, and this time it was New Westminster. And this caused a lot of ribbing online, but all good-natured fun aside, New Westminster is a lovely place to visit. We want to hear from you. Is New Westminster underrated? And what are some other underrated hidden gems around BC? You can call us 1-800-825-5950, 604-669-3733. You can hit pound 690 on your cell phone. You can email us too, bctoday@cbc.ca. I'm joined now by Vancouver Island University Professor of Recreation and Tourism, Jen Houtby Ferguson. Hello there.
Hi, Michelle. Thank you for having me.
Thanks very much for joining us. When was the last time you were in New Westminster?
Oh gosh, actually quite recently. I was just there earlier this summer. It is a beautiful part of British Columbia. In on the Quay, love it. It's gorgeous. They have a great restaurant, the Boathouse Restaurant.
Right.
I had halibut. It was delicious. So I encourage folks, hey, any chance we get to promote our beautiful province, we should take full advantage.
Right. And so what do you make then of some of the ribbing around, maybe some surprise around New Westminster? The contestant himself overbid the stay at the hotel in at the Quay in New West and was shocked that it was at how affordable it was. But what do you make of that? People kind of being like, oh, really?
A case of we take for granted what's in our own backyard,
right?
And British Columbia and particularly New West is one great example, but there are so many other great examples where we think, oh, that's just right there, it's not special, and the reality is it is special to people who come from outside of our country or outside of our province or territory. So I think we're lucky to have what New West offers. It is a quaint little, it's not so little, I mean it's so close to Vancouver, but I think that proximity, the jumping off point to other parts of BC, we know when visitors come to this part of the province that they go to other communities as well. And so being in New West and the opportunity to really immerse yourself and explore, walk along that beautiful boardwalk.
Yes.
Sounds great. Sounds like a great 6-day adventure to me.
You are selling me. You are selling me on this. Yes, the last time I was there, I went actually for to see a play at a little tiny theater, very old and heritage theater over in the Queen's Park area. It was lovely. It was a nice evening. And I've been there many times with my kids. We used to go to the petting zoo, the water park. Okay, we can go on. The Anvil Center is gorgeous.
Yes. What a beautiful venue. That's an amazing facility. Great opportunity to host conferences and events there. Amazing.
There you go. Okay, so we're
on Team New West.
That's
clearly.
right, Team New West. And I think they're going to try, I believe Tourism New Westminster is trying to get the contestant over to really enjoy it firsthand. So for you then, what are some hidden gems? We know you are fond of New Westminster, but what are some other hidden gems in the province that people who, these are places in our backyard. We may not think too much of them. But what are those places you think we should spend some more time in?
Oh my gosh, I have so many. I think maybe we should start with the Gulf Islands and day tripping from beautiful Vancouver Island. I am joining you today from Snuneymuxw territory, also known as Nanaimo. And it is so beautiful on Vancouver Island, even in the wintertime. And I think, what a great way, if you're in Victoria, you're in the Cowichan Valley, or even in Nanaimo, you can pop over to Gabriola. There are some amazing art galleries, some really neat and fun restaurants. I think about the Woodfire Pizza place that's on Gabriola, the Fishbone Studio, which is like a little art. There's all these different artisans on Gabriola. Most people don't even know that. So it's right in our own backyard. They have an incredible market through the summer season. And I also think about Salt Spring. They have an incredible market, a beautiful, beautiful waterway. There's restaurants right there, shopping right there, some really cute little B&Bs on Salt Spring. And of course, Pender Island. I mean, even in the wintertime, Pender is gorgeous. So kind of like your own version of storm watching, but you're doing it from the southern part of Vancouver Island instead of Tofino Euclid, which is also gorgeous. Tofino and Euclid, of course, well known for their storm watching. So that's sort of the start of my list. I have a very extensive list.
I can tell. Yes, you're right. And Tofino, not exactly, underrated or a hidden gem, but it's nice to know about those other things. And so many artisan fairs are coming up on the Gulf Islands as well, which makes me jealous.
I think in other parts of Vancouver and other parts of British Columbia, certainly on Vancouver Island, we have so many craft fairs, handmade Christmas markets, for example, that they start just this coming weekend and they carry us right through until the holiday season. So that's always a great, really neat way to meet some new artisans. Usually there's some food and local food purveyors as well, which is, top of my list for sure.
Yes.
I'm gonna add to this, and I'm gonna say, one of the things we really like to do in our family is go to Wild Play. And so if folks have not been to Wild Play, it's open all the way till December the 17th in Nanaimo. I know there's one in Victoria as well. And so you can still go even at this time of year. There's usually a few less people. It's open on the weekends, but what a fun way to spend an afternoon, especially if you do an early holiday celebration. You can work off those calories.
Yes, because this is like an outdoor park. You have to do climbing. I think you can... there are zip lines and bridges in between trees and things like that. There's actually a canopy. There's one in Maple Ridge as well.
Yes. And the thing I love about it too is that it's for all ages, which is great too. So you can take the kids, littler kids, 5, 6 years old, all the way up to adults. So that always makes for a really fun adventure.
I can see you looking down. Do I keep going? Is what you're wondering. So do you think that everybody's worried about cost these days, right? And if you are planning some kind of holiday trip, perhaps staying close to home, what should they consider? You've already mentioned some lovely things there, but what can they consider if they want to save a little bit this holiday?
I think it's really about looking at what's in your own backyard. So I happen to be in Nanaimo, and we have some incredible parks and trails in our community. And sometimes we forget again about the things that are right in our own backyard. So Nanaimo does a really great job, for example, of posting their parks and trails. There's little maps you can follow. Bowen Park is one that comes to mind. This time of year, the waterfall is really gorgeous. The leaves still have a little bit of their color on them. It's absolutely stunning. And it's like, that's no cost, right? You can just go down to the park. They have sporting equipment available for borrowing. So not even a cost. You can borrow ultimate frisbee, you can borrow tennis rackets, that sort of thing. So again, you can get outside. We still usually on Vancouver Island have really gorgeous weather this time of year. And also think about most communities have a glow-in-the-dark skate or a free skate that they offer, or it's very low cost, $2 or $3 to attend a skating event at your local arena. The pool here in Nanaimo is a wave pool. That is next level. So take the fam and go for the wave pool.
Price is right. You need to do a price pack with Nanaimo,
absolutely.
I think is the message here. We are taking calls. If you feel that your part of BC is underrated, we would love to hear from you. And what about New Westminster too? Because that's what started our conversation about hidden gems in BC. Do you think that, do you know of some hidden gems where you live? What about in New Westminster? What do you do when you are over there? They also have a lot of food truck festivals and craft beer festivals and things like that. So New West, I think I heard it called the Brooklyn of Metro Vancouver, because we always like to come up with something comparing us to New York. Is it the hipster place that is the place to be? You can give us a call, 1-800-825-5950, 604-669-3733. You can hit pound 690 on your cell phone. And my guest is Jen Houtby Ferguson, who is a professor of recreation and tourism at Vancouver Island University. And we have a call coming in. We'll try to get to that before the end of the show. Do you find that communities are in light of declines in certain industries, perhaps looking to tourism and boosting the things that you can do there?
I think tourism has long been an economic generator in communities, and it sometimes can be sort of a quick alternative. We certainly in British Columbia, parts of British Columbia have been reliant on the natural resources sectors, and that's perfectly okay. But we are starting to see a shift, and I think too with the wildfires that we've experienced, some communities being impacted where the people who would traditionally be on the highway coming to their community are maybe coming at a different time of year. So maybe they're deciding to come in the fall and the winter time instead of traveling in what we would consider to be sort of peak summer season.
Right.
There's still so many beautiful things to do throughout this province. I actually last week was in Radium Hot Springs and Invermere in the Kootenay region.
Yes.
Absolutely stunning. First snowfall of British Columbia that I got to experience this year. It was gorgeous. And that's a hidden gem. Tiny little community. I stayed at this beautiful resort property. It had an outdoor pool. It was incredible. And then the hot springs are literally right there, and you're in the mountains. It was gorgeous.
A treat. What
Drive
a treat.
Through Kootenay National Park. Stunning.
Lynn is joining us from Victoria. You want to talk about Atlin, Lynn?
Love Atlin. I've also been there. I lived in the Yukon for 4 years. Good choice.
There you go. And Lynn, are you there?
Yeah.
Oh, yes. Okay. So tell us about Atlin. Beautiful Atlin.
Well, one of the things that I really like is the fact that there's no garbage on the streets. People are very good at picking up or maybe not even dropping litter in the first place. But although it's a long drive, yes, once you get there, it's got the houses from the turn of the century, cute little buildings. It's got Atlin Lake, which is just, you look out on this beautiful vista. It's got hiking nearby. There's a hot springs up the road. And it's just quiet, but beautiful.
Oh, wonderful. Lynn, thank you very much. You painted such a gorgeous picture there.
Oh, good.
We'll make the drive.
Good.
Thank
Bye
you for the
now.
call. Bye-bye. And let's squeeze in Jen in Prince George. I have 30 seconds, Jen, but should people go to Prince George?
Absolutely. Yes.
Is Jen there?
Yes, I just wanted to say Prince George is the unsung hero in the north.
There you go. What's your favorite thing in Prince George? Place to visit?
The outdoor recreation is amazing. Mountain biking.
Absolutely.
Skiing,
and Mr. PG.
country.
Go see Mr. PG.
Hiking.
Jen in Prince George, thank you very much. I'm sorry, Jen Helpy Ferguson. That must have been confusing for you. Thank you. You've made us all inspired to go visit the place next door.
I'm glad to hear it. Thanks for having me, Michelle.
Oh, wonderful to speak with you.
Happy traveling.
You too. Vancouver Island University Professor of Recreation and Tourism, Jen Helpy Ferguson. That is it for us. I'm Michelle Eliot. Thanks so much for joining us.